My name is Donald. I'm going to be the nurse practitioner today, taking care of you today. But before I proceed, we're going to be doing a head to toe musculoskeletal examination or assessment. But before I proceed, it's very important for me to seek a permission and obtain consent from you, because this video recording is going to be posted to YouTube, and that will kind of enable my professor or instructor to see what I'm doing. I just wanted to say whether it's okay for me to go ahead, yes or no. Yeah. All right, thank you. So like I said, I'm going to be doing a musculoskeletal exam, and this is going to be comprising from your head to the toe of your feet. So it's going to be a lot of things that we're going to be doing. So it's going to encompass doing the inspection, palpation, and range of motion, and also different specialty tests. So I'm going to be starting off by inspecting your hand. I'm going to be inspecting your hand, making sure, and I'm going to be comparing the two, making sure there is no swelling and there is no redness. Also, there is no deformity, any visible deformity. And I'm comparing both to make sure they are symmetrical. And see, you have bandage here. You kind of injure yourself doing it again, don't you? All right. So I'm looking at that right now. Like I said, I'm looking for any nodules, any swelling, any redness. So I don't see anything like that. So I'm going to be palpating, meaning that I'm going to be palpating the DPI joints, which is the proximal and a distal proximal interphalangeal joints with metacarpal phalangia. So I'm looking at that, making sure as I'm palpating for any nodules, and as I'm doing, I'm making sure there is no redness, tenderness, you don't feel any pain as I'm doing that. And I'm also doing that on the other hand, making sure they're kind of symmetrical on both sides, palpating for any nodules, so I don't see anything like that. So I'm going to ask you to flex your fingers for me, so you can do this way. Yeah, or you can make a fist. So I'm going to have you do this way for me. Okay, so that's good. The other thing I'm going to ask you to do for me is to kind of adduct your fingers, your hand, by spreading your fingers this way for me. Okay, this way for me. I can do the other one too. So I'm going to let you adduct by bringing it back to the midline this way. So that's good. All right, so that's adduction. So you already made a fist. So I'm going to move on to do the wrist. I'm also inspecting your wrist this way. I'm also checking, making sure they are symmetrical. I'm looking at for any swelling, any redness, any nodules, or any deformity, which I don't see any. And I'm also going to be looking at the radial and ulnar heads, making sure there is no deformity. That's pretty much what I'm looking for. And compared to the other side, there's nothing like that. So what I'm going to be doing is I'm going to have you flex your hand for me. You're going to flex your wrist for me. You're going to do this way. So you are flexing, you're going to go this way. Okay. And if you are extending, you're going to go this way. This way, you can do this other one like that too. You flex, you go down when you flex. And you extend when you go up. Good. So making sure there is no tenderness or anything like that. What I'm also going to ask you to do is I'm going to have you adduct for me. So you're going to keep your hand straight this way, and you're going to move your wrist away from the body. That's adduct. You're going to go this way, and I want you to adduct, bring it back to the midline. Okay, and make sure everything looks fine. If you do the second one like that too, yep, and bring it back to the midline. So that's that about that. There's another test that is done. It's called the snuff box joint right here. It's like the crease around here. When I'm pressing it, do you feel any pain? Okay, making sure that it's a way to test for any metacarpal syndrome, tunnel syndrome, metacarpal tunnel syndrome. So the other thing I'm going to check for now, there's specialty test that is done to check for any metacarpal tunnel syndrome. Carpal tunnel syndrome. So the first one that is done is to ask you to hyperextend your wrist. If you want to, you're going to go this way for me. So what I'm going to do is that I'm grabbing your hand this way, and I'm going to, this is a median nerve here that I'm going to check, use the middle finger of my dominant hand. I'm going to tap right here. Let me know if there's any, if you feel any pain. If there's any pain in your second, third, and fourth fingers, it's an indication for carpal tunnel syndrome. Carpal tunnel syndrome is it's a numbness and tingling sensation that is felt in the hand or in the arm, and this is caused by a pinch nerve. So, like I said, I can use the middle finger of my dominant hand, and I can also use the reflex arm by doing this. And if you feel pain, that's an indication for carpal tunnel syndrome. The other test that could be done apart from ternary test is called feeling test. And feeling test is done by assuming this position. If you want to go this way, by assuming this position. So I'm going to have you hold it for 40 to 60 seconds. And if there's any pain that you felt in your hand, it means there is a carpal tunnel syndrome. Or you can also reverse it by doing this. Can you reverse this by doing this? So that's also, I'm going to have you hold it for also for 40 to 60 seconds. And that is also if you are feeling pain and if there's any tingling sensation or any numbness or tingling sensation in your fingers, it's an indication for carpal tunnel syndrome. Okay, so that is that about that. So that's that about the wrist. So what we're going to be moving on to right now is your elbow, and I'm looking at the elbow right here on both sides. I'm looking for any inflammation, any redness, any deformity, any nodules. I'm not seeing anything like that. I'm also comparing on both sides. This is the olecranon process, which is the tip of the elbow. And I'm also looking for any redness, any inflammation, any nodules, any deformity, which I don't see. So the next thing I'm going to do is to palpate. While I'm palpating the olecranon process here, I'm trying to feel for any swelling, any nodules, and when I'm palpating, I'm making sure you don't have or you don't feel any pain. Okay. While I'm also doing this, I'm also palpating the lateral epicondyle which is more like the tennis elbow, and also the medial epicondyle, which is the baseball elbow, like this. And I'm also doing it on the same side. This is the medial epicondyle, this is the lateral epicondyle, making sure there is no so I'm also going to have you to flex your elbow for me by doing this. Yeah. And I'm going to have you extend your elbow for me by doing this. So that's good on that. And that is your elbow. The other thing I'm going to have you to do for me for the elbow is to pronate, which is going to be this way. You pronate this way. Do it for me. You pronate. You bring it this way. Look at me. You pronate and you supinate. So your palm facing up. When you pronate, the palm facing down. So that's another. You can do the second one like that. Then good. So we're gonna move ahead and do your shoulder. I'm looking at your shoulder, making sure it's symmetrical. The alignments. There is no one shoulder is not hanging lower than the other, which could be an indication for dislocation. and I'm looking at it, it's symmetrical. There is no redness, there is no swelling, there is no nodules. Yeah, which is good. So I'm gonna also palpate, which is gonna be, I'm palpating from the external clavicular notch right here, and I'm moving my finger down to the acromioclavicular joint, to the summit of the shoulder right there, where there's a prominent bone right here. I'm feeling for that, and I'm also going to feel for the bicipital groove around here, and also the subdeltoid bursa around here, and I'm also feeling for any tubal humerus and the sacroid right here. So making sure, yeah, we're aligned, and so I'm palpating, I'm making sure there is no tenderness, you're not feeling any pain, which is a good thing. And I'm gonna have you to flex your shoulder for me by going 180 degrees, that's above your head. Want to do that for me? Yeah, good. Hold it. And if you want to do the other one for me, 180 degrees, boom, that's good. So, and I'm gonna, if you want to stand up for me, so what you're gonna do is you already flex. So I want you to extend, and the only way to extend, you can stay like that. The only way to extend is by doing this. You go 60 degrees backward. Yeah, that's extension of your shoulder. Good. If you want to sit down again, that's the position, which is good. So the extension is good, and that's and you did the flexion. So that's for your shoulder. The other thing I can ask you to do for me, even though you are sitting down, is to adduct, moving your shoulder away. If you want to do this for me, do that one, do this other one too. That's adduct. You're going this way. So your hand moving away from your body. And you adduct, you bring it back. Okay? So that's good. So there are different specialty tests that is done for the shoulder to make sure you don't have any rotator cuff. The first one you can do that is called, we can call it the drum ham test. So you have your ham abducted like you want to do. So I'm going to ask you to slowly bring your arm down this way. See, this is abduction. We're doing a drop ham test. So you slowly bring it down. Slowly bring it down. Slowly bring it down. Slowly bring it down. So if it's very difficult for you to slowly bring it down, like by you suddenly dropping your hand, when I say hold, if you have any rotator cuff injury, it will be hard for you to slowly bring it down because there is going to be pain and tenderness. So what you're going to do is you're going to drop the finger, your hand. So that's another way to know that you have rotator cuff injury. The other test that could be done is called Hawking test. Hawking test is you flex your shoulder and you flex your elbow. So it's this way. If you want to flex it for me. So what I'm going to do, the Hawking test, I'm going to internally rotate your hand this way. And if there's any pain while I'm doing that, that means it's an indication, could be a tendonitis or it could be a labrum tear, which is an indication of a rotator cuff. The other test that could be done is called NERI test or near test. So what you can do is I'm going to have you flex your shoulder this way, flex your shoulder this way, and I'm going to apply pressure down this way. And if you feel any pain while I'm doing that, it shows that it is an indication for rotator cuff. So we are pretty much done with the shoulder. So I'm going to have you stand up for me. So we are going to do your head. I'm going to come right here. Let's move this. Stay from the camera. So I'm going to have you do, so what we are doing right now is I'm doing your head and your neck. So I'm inspecting your neck right now, your head and your neck. I'm making sure the trachea is midline. No, go this way, face that, yeah. The trachea is midline. There is no swelling. I don't see any redness or anything like that. It's good. So what I can also do is to palpate. And when I'm going to palpate, I'm going to start off from the temporal mandibular joints, which is right here. And when I'm doing that, I'm going to ask you to open your mouth for me. If you want to open your mouth for me, open your mouth for me and close it. Good. So that's good. Any pain when they do that, there is no pain, so which is a good thing. I'm also going to palpate the anterior cervical and also the posterior cervical. I'm also doing on the other side, making sure it's symmetrical, and I'm also doing the posterior cervical. And while I'm on this, I can also palpate the clavicular area and infraclavicular area. I'm doing it on both sides, so it's good. So the other thing that I'm going to do, I'm going to ask you to flex your neck for me. So what you can do is your chin to touch your chest, going this way. That's flexion of your neck. So I'm going to have you extend your neck for me by looking up. Good. Any pain? No. So the other thing I'm going to ask you to do for me, Arnold, is that I'm going to have you rotate to move your neck side to side this way without moving your body. Yeah, good. So the other thing I'm going to have you to do lateral movement of your neck by asking you to let your ear touch your shoulder by doing this on either side. Yeah, doing this on either side. Good. The other thing I'm going to ask you is to open your mouth and move your jaw side to side. Good. Go face the camera. You should have camera. Yeah, open your mouth and move your side to side. Good. So the other thing I'm going to ask you to do for me, so you did that already, is to align your 3 fingers. 3 fingers, align them vertically and open your mouth and put it this way. Yeah. That's good. So there's no pain, right? So we're done with the neck and the head and all that. So the next thing we're going to do is your spine. So I'm going to have you turn your back on me. I'm looking at your posture, making sure so your posture, making sure it's normal and all that. So I'm looking at the symmetry on both sides. I'm inspecting for any swelling, any redness, any nodules, nothing like that, any deformity. I'm also trying to look at the shoulder alignment, making sure one shoulder is not higher than the other, or one shoulder is not lower than the other. Because in case there is, then there could be indication for scoliosis. Scoliosis is the sideways curvature of the spine, or kyphosis, which is like forward rounding of the cervical, which is more like hunchback. So I don't see that. And the other one is lordosis, which is pretty much seen in the lumbosacral area. That is the excessive inward curvature of the spine. So I'm not seeing that. So I'm going to start off now by palpating your, and I'm starting from the C7 area. Starting from C7 area here. And I'm going to be palpating all the way down to the intervertebral spaces. And I'm making sure there is no depression in the disc and there is no any disc sticking out. And I'm also watching for, when I'm doing this, I'm watching for step-up sign, which could be an indication of spondylolisthesis. This could be felt around the lumbosacral area. That's good. The other thing I will do is to check for your neck. That's a special test that is done for the cervical. Since I'm on the cervical area, I'm going to do this called spalling test or cervical compression test. So this test is to make sure your neck, there is no pain. So while I'm holding this way, I'm gonna bend this way. So if there's any pain that radiates, it could be an indication for a cervical radiculopathy. Which, do you feel any pain as I'm bending that way? Okay, this way? What about this? Okay, so that's good. So that's it with the spine. What I'm going to ask you to do, we are not done with the spine yet. So I'm going to make sure, I'm going to have you to bend down and touch your toe. See if you can touch your toe. Bend down. So that's good. And then when you bend down, no, stay there a little bit. When I bend down, I'm trying to see the alignment of your, making sure, like I said, there's no kyphosis, there's no scoliosis or hunchback. And I'm also, holding your hips right here, making sure they're well aligned. And I'm going to ask you to extend yourself by bringing yourself down, back this way. So that's good. And I'm going to have you to rotate for me. To go left, lateral, go lateral, bend down this way, bend to your right. To go 35 degree, go this way, watch me. Yeah, go. Yeah, I'm gonna have you do the second on the other side. Good. So you're not done. Come on. Yeah, stay here. Don't go ahead of the camera. You can do it? Yeah, do it. Go left. And go right. Okay, then rotate for me. So you watch me as you rotate. Watch me. So you rotate this way. Rotate for me. Yeah, you don't rush. Okay. So that's good. So that's it for the spine. So we're gonna move down to the hip. That's it for the spine. So I'm gonna move down to the hip right here. I'm gonna have you stay right here. This is your phone. Yeah, lay it back for me, please. So your hip, I'm gonna have you lay down supine. If you want to come down so that you can lay down flat on your back. Good. Supine. So good. So I'm inspecting your spine. I'm looking at your hip right here, making sure there is no swelling. I'm looking at the hip bone right here, and on the other side they're symmetrical. And I'm looking, I'm also going to be palpating, making at the anterior superior iliac spine, which is like right here. And I'm also feeling on the other side, anterior superior iliac spine. And also on your back, if you stand up this way, there is also posterior superior iliac spine right here, where there's two dimples on your back. That's your posterior superior iliac spine. So I'm going to have you lay back on your spine. So you can move my hand a little bit, make it easy for you. So while you're doing this, I'm going to ask you flex your knee for me, making sure your hip, there is no dislocation or anything like that, or flexion, hip flexion, contraction. We're going to do that. So I'm going to have you bring your knee up this way. Hold on, relax, relax. I know, relax your knee. So bring your knee, you stiffen it. So this way. So, and I'm going to, that's about 5 degrees, and I'm going to let you go. I'm abducting, I'm going inside this way. If there's any pain, you're going to feel it. And I'm also going to abduct, bring it back. I'm going to let you lay on the side for me, laterally on the side. Yeah, this way, good. So what I'm trying to check for, and I'm going to have you flex your knee this way. Boom. So I'm checking for right here, your greater truncator. Your greater truncator. And hey, Tabitha, go. That is this right here. And close the door. And I'm going to, right here, your greater truncator. And I'm going to check right here. This is the ischial tuberosity. that is the bone that we use to sit down. And in between the greater truncator and the ischial tuberosity, it's the sciatica notch. If there's any pain, the way you flex your knee right here, you're gonna feel pain in your back or in the ASIS. So that's good. We don't have any. You can do that one too, that way. So what I can do, the other thing that I'm gonna do is to flex your knee for me. So you're gonna flex your knee, you wanna move on a little bit, you're gonna bring it back this way. See, when you flex your knee, you bring it back this way. Good, good. So you wanna extend your knee, you're gonna kick it up this way. Good. Let me come on a little bit. I think you're out of the camera. So yeah, flex your knee, yeah. So flex your knee, good. So extend your knee, kick it up, good. Do the same, and then good. So what we're gonna do right now, we'll move this back a little bit, in the camera. So there, the next thing I'm gonna do is to rotate. I'm gonna move up a little bit. I'm gonna adduct your knee. So I'm grabbing your knee this way, and I'm abducting, meaning that I'm moving it away from you this way. That's adducting your knee. And abduct is bring it back. Okay, so you can do the same. Boom, I bring it back. So there are specialty tests there are many specialty tests that could be done with your knee. With your hip. That's your hip. So the thing that I can do, the test I can do for your hip. We're still on the hip. Is it's called Thomas test. You want to lay down? You're going to lay down supine. Yeah, on your back. So Thomas test is to check if there's any hip flexion contracture. And the way it's done is you're going to bring your knee to your chest. You want to bring your knee to your chest for me? Both of them? Good. So hold on to them. So I'm going to bring one of your leg back and hang on to this. That's the check. That's the Thomas test. So this one, there is no stiffness, and this one is comfortably resting on the couch, which is good. Why are you still holding on to this? Do you feel any pain while you do that? So good. So just to check if there's any hip flexion contraction. So that one is good. You can let go. The other test to do, specialty test, is called a Patrick Faber test, and that is also done by having you lying down supine. But what I'm gonna do is to have you flex your one knee. You wanna flex it for me? So this way, and I'm gonna place it on top of your knee, other knee, this way. Yeah. So while I'm doing this, I'm gonna palpate, apply small pressure to your anterior superior iliac spine. Do you feel any pain? No. And I'm also feeling on the other side on your back here for the posterior superior iliac spine. Do you feel any pain there? No pain. So we're trying to see if there's any sacroiliac joint pain. So there is nothing like that. So that's good. So the other test that is also done. So that's that about the hip. So we're gonna move on to do the knee. So your knee, I'm inspecting your knee. You can sit up now. I'm inspecting your knee. Go back. I'm inspecting your knee. I'm making sure there is no swelling, there is no redness, there is no deformity or anything like that. I'm comparing both make sure they are symmetrical. And I'm going to be palpating because your knee, it's kind of framed with the epicondi, lateral epicondi, medial epicondi of the femur and the condi of the tibia and fibula. So in the lateral epicondi, the groove of the lateral groove of the meniscus right here, and the lateral and the medial, in between there's a meniscus. The meniscus is just like the shock absorber of the knee, the stabilizer to stabilize the knee. And so if I palpate on the lateral groove right here, and if you feel pain, it means that there could be an injury to the meniscus. Do you feel any pain? Do you feel any pain? No. Okay. So that's good. So the other test, so I'm going to ask you to kick your, I think I already did that last time. Ask you to flex your knee and also to extend your knee. I did that already. So the other thing I'm going to do is the specialty test that is done. And we are doing that in order to make sure you don't have any lateral, any medial collateral ligament damage. So what I can do, that first test is called Fago stress test. Fago stress test. So the Fago stress test is done by having my left hand to the lateral side of your patella, and I'm grabbing my other one to the opposite side of the medial malleolus of your ankle, right here. And what I'm going to do is I'm going to adduct, bringing it out. While I'm bringing it out, I'm trying to see if there's any gap in the medial collateral ligament right here. What it's supposed to do, the job of the medial collateral ligament is to hold the knee so that it's not displaced, it's stable. So if there's any gap here, and when I'm adducting away from the body, I'm making sure I'm not hurting you and you're not feeling pain, which is going to be a sign that there could be an injury to that. So do you feel pain? And I'm rotating about 20 or 30 degrees. Do you feel any pain? No pain. So that's good. So to do the lateral collateral ligament, I'm going to have to come on this side to do that. And basically, I could even sit down right here. But what I can do though is I'm going to switch my hand the way they are positioned before. So I'm going to have my right hand to grab the medial of the patella on this side. And I'm going to have my left hand to grab the lateral malleolus of your ankle right here. And what I'm going to be doing is I'm bringing back, that's adduct, bring it back to the body this way. I'm bringing it in. So I'm trying to feel any lateral, collateral ligament here. If there's any gap. So right here, do you feel any pain? No. Okay, so that's good. So there's no pain, it's good. So the next thing I'm going to do is called Lachman test. So Lachman test is also checking for any laxity of the anterior superior cruciate ligament. And the only way to do that test is by using my right hand to grab the head of the femur right here. And I'm using the other hand to grab the tibia, over the tibia tuberosity. And what I'm going to be doing is to pull and push. I'm pulling and pushing. So making sure that this way I'm pulling and I'm pushing. So if I see there is nothing that is kind of out of the way, there's no laxity. So making sure that the anterior superior cruciate ligament is it's intact. That's pretty much what we are looking for. And the way I'm doing right now, it's okay. So the last test, specialty test for the knee, is called McMurray test. And the only way you can do that is also checking for pretty much the same, the anterior, superior, posterior cruciate ligament. And the way to do that is to flex. You're gonna let you lay down on your back. That's good enough. And I'm gonna flex your knee, and I'm gonna this way up, and I'm gonna medially. This is the medial. I'm gonna medially rotate this way. So I'm also checking for any laxity. Do you feel any pain? Okay, no. So that's it. Wanna sit up? So that kind of concludes our test on the knee. So the other thing I'm gonna be doing, I'm moving down to your toes. If you don't mind, I'm gonna take off your socks. So your toes, I'm also inspecting on both sides. I'm looking for any swelling, any inflammation, any redness, which could be a sign of infection. And I'm also looking at any nodules, any cones, any plantar warts, any bunions. I'm looking at that. I'm also checking if there's any planus, making sure there are no flat feet. So I'm inspecting all that. I'm also going to be palpating. I'm going to ask you, I'm going to be palpating the distal and proximal interphalanges and metatarsal right here. I'm palpating for any pain, if there's any arthritis, like I did in your hand. And if there's any gout, it's going to be the big toe right here. There's nothing like that. Do you feel any pain? So this is my metatarsal right here. And I'm going to have you flex your toes for me. You flex this way, and then you extend this way. Good. And I'm also going to be inverting this way inside, and I'm inverting outside. Okay? The other thing I'm going to be doing is to check your ankle. I'm looking for any redness. I'm looking for any swelling. I'm looking for any deformity. I'm looking for any nodules and things like that. And I'm also going to palpate your ankle right here, the lateral and the medial inside. The medial and the lateral outside right here. The medial malleolus. And I'm also checking the Achilles. I'm palpating for any, just like I inspected them, I'm also going to be palpating for any tenderness, any mass, any nodules, nothing like that. So I'm also going to ask you to dorsiflex for me. Dorsiflex means you're going to bring this way, and that one too, boom. And plantar flex, you're going to go that way. I'm palpating for any, also like I palpated for fasciitis, also plantar neuroma, and things like that. So, and I'm also going to rotate this way. Okay. So, that kind of concludes our head to toe musculoskeletal exam. Thank you so much. And that's it.